5 possible causes of pancreatic cancer, a cancer known to be extremely dangerous and one of the deadliest, causing over 450,000 deaths yearly worldwide, and it's becoming increasingly common. The incidence has risen 1% annually since the 90s. After diagnosis, the 5-year survival rate is only 11%, meaning only 11 out of 100 diagnosed live beyond 5 years. Today, we'll discuss 5 factors that increase the risk of pancreatic cancer and provide key info about this severe disease and how you can prevent it in daily life. First, let's talk about how pancreatic cancer develops. Like all cancers, cells mutate and multiply uncontrollably. What's the pancreas's function? It helps digest food by producing enzymes and also controls blood sugar levels by producing insulin. Genetic, environmental, and behavioral factors can trigger changes in pancreatic cells and cause cancer. These cells can multiply uncontrollably, forming masses and tumors that can be benign or malignant. The most common type of pancreatic cancer is what we call pancreatic adenocarcinoma. Here's a good relevant question. How long can you have pancreatic cancer without knowing it? It's hard to diagnose this disease early because it often doesn't show signs or symptoms. Pancreatic cancer is usually diagnosed when it has spread to other parts of the body or is advanced. So someone can have this cancer for decades without knowing, as it's only caught early in 10 to 20% of cases. While it may develop slowly, it's a very aggressive cancer. Do you know anyone with pancreatic cancer? Share in the chat or comments if you know someone who's dealt with this disease. Tell me about your experience with pancreatic cancer. As for my experience with pancreatic cancer, I haven't had any cases in my family, at least not that I'm aware of, but during my time in medical school, when we were in the hospital wards looking after admitted patients, we saw how severe and painful this hard-to-treat disease with poor prognosis can be. So folks, if pancreatic cancer runs in your family, especially parents, siblings, or kids, you're at higher risk. So if you have relatives with this disease, you need to be vigilant. But a family history doesn't guarantee you'll get pancreatic cancer. It's just important to be aware to avoid delayed diagnosis. Even without family history, you're not immune to them. Either way, stay alert and take steps to reduce your risk of developing. So, does coffee cause pancreatic cancer? What do you think? You, watching right now, what's your opinion? Does coffee raise or lower pancreatic cancer risk in your view? Share your thoughts in the chat or comments. In science, folks, information is often conflicting. I might find one article saying coffee increases pancreatic cancer risk, and then another article where coffee didn't raise pancreatic cancer risk, where coffee lowered pancreatic cancer risk. So if you want to know, and thumbs up this video if you'd like me to explain the link between coffee and pancreatic cancer. Leave a like to help others find this answer too. So folks, does coffee cause pancreatic cancer or not? Well, here's the deal. Some studies say it might, others say it may protect due to antioxidants, because coffee has anti-inflammatory properties, and I believe it's more likely protective against pancreatic cancer than causing it, as long as you don't add sugar, obviously. So, folks, that's what I've been saying. The studies and information are conflicting. What's my opinion based on this conflicting data? I believe coffee either slightly protects against cancer due to its inherent substances, which are anti-inflammatory and antioxidant, and in most cases, yes, protect against various cancer types, or it has no real influence on the disease's development. I don't think coffee is a risk factor for pancreatic cancer, so enjoy your coffee, but watch the sugar. I'll show you soon how sugar can indeed increase your pancreatic cancer risk. Now, let's discuss 5 modifiable factors for pancreatic cancer. That is, factors that increase the risk of this disease that you can change, that you can act on to eliminate these factors from your life. Shall we? 5th factor, tobacco use. Smoking is one of the main risk factors for this disease because cigarettes contain chemicals, carcinogenic toxins that harm your entire body, and about 25% of pancreatic cancer cases are linked to smoking. 4th modifiable factor, being overweight. Why? Excess weight causes chronic inflammation, raising cancer risk. Moreover, if you have excess body fat, meaning too much fat, It leads to an increase in hormones like insulin and estrogen, which are also linked to a higher risk of this. Being overweight also alters bile acid metabolism, contributing to cancer. Third modifiable factor, diabetes. Diabetes is mostly a modifiable factor as it's directly linked to lifestyle choices. The pancreas helps control blood sugar levels by producing insulin. If you have diabetes, you have insulin resistance, which stimulates cancer cell growth. Diabetes damages the pancreas and alters glucose and insulin levels, promoting cancer. The second modifiable factor is chronic pancreatitis. In chronic pancreatitis, it can cause scarring and fibrosis, which increases mutation risk, raising the chance of cells altering their genetic material to something harmful. Pancreatitis also changes the pancreas's biochemical environment linked to smoking and alcohol use. So certain genetic mutations linked to chronic pancreatitis can also increase cancer risk. How can we manage chronic pancreatitis? By stopping its causes like alcohol, tobacco, and poor diet. First modifiable factor, exposure to chemicals. Avoid inhaling certain products and use masks when possible. What are these products? Polycyclic aromatic hydrocarbons in stain removers and oven cleaners. Avoid perfluoroethylene found in dry cleaners. Ethoxylated alcohols in glass and surface cleaners. Formaldehyde in disinfectant and bleach, and chloroform used in general prosthetic. These are 5 risk factors we can modify or eliminate to protect ourselves from. Now, there are some factors we can't eliminate, which are non-modifiable. What are they? Age. You can't change your age. So the risk of pancreatic cancer rises after 45, with the average diagnosis age being 70. Second factor, gender. Men, for reasons unknown, have a higher risk of this. Third factor, family history. Genetic factors like Lynch syndrome, familial pancreatitis, and Peutz-Jeghers syndrome can't be changed. Our inherited genetics passed down from our parents are mostly unchanged. The fourth non-modifiable risk factor is chronic pancreatitis genetic mutation. Now, let's discuss 4 other factors that may be linked to pancreatic cancer. The first is diet, which is a modifiable factor. We see that processed meats like sausage, hot dog, ham, bologna, salami, turkey breast. This raises the risk of pancreatic cancer, similar to how high sugar and refined carb intake contribute to diabetes. What else? Sedentary lifestyle linked to obesity and diabetes also increases pancreatic cancer risk, as do alcoholism and certain infections. Who wants to learn about pancreatic cancer prevention? There are things we can do to significantly lower the risk of this problem. So, if you want to know the prevention strategies, write in the chat or comments section and say, Doctor, I want to know the prevention strategies. I want to know how to protect myself from pancreatic cancer. Let's go, Vanderlei wants to know, folks. I'll give you a preview of the strategies for preventing pancreatic cancer. These are the same prevention strategies for colon cancer, stomach cancer, heart attacks, and strokes. So, folks, the prevention strategies for today's most deadly diseases are the same. Who can guess the prevention strategy for pancreatic cancer, colon cancer, heart attacks, and strokes? Anyone know? I'll give you a hint about what we can do in our daily lives, what we can do every day that will reduce our risk of developing these diseases. Isilda Barras mentioned diet, which isn't wrong. Diet is one aspect we need to be careful about and pay attention to, as it will help protect us from diseases. However, it's not just diet that protects you from cancer, heart attacks, and strokes. It's a healthy lifestyle overall, including diet. So, if you eat well but don't exercise, you're still at risk for cancer. You need to eat well, exercise regularly, maintain a healthy weight, avoid alcohol and smoking, sleep well, manage your anxiety, and yes, this is linked to a higher risk of developing pancreatic cancer, breast cancer, prostate cancer, stomach cancer, esophageal cancer, and bowel cancer, okay? Heart attack, stroke, high blood pressure, diabetes, depression, anxiety. So everything I've mentioned here, diet, physical activity, maintaining a healthy weight, no drinking, no smoking, stress management, good sleep, all of this will be crucial for protecting yourself from almost all diseases we face. While you can't prevent all diseases, as infectious ones aren't as affected by these factors, they do impact the prognosis. So let's look at an example here. If 2 people get dengue, both 60 years old, okay? A 60-year-old person caught dengue. They eat well, maintain a healthy weight, exercise, drink water, have no high blood pressure, diabetes, or need for medication. This is person number one who got dengue. And person number two who got dengue is the opposite. They're overweight, don't exercise, smoke, drink alcohol, don't drink water, live stressed, have high blood pressure, diabetes, sky high cholesterol. Who's more likely to die from dengue? The healthy 60-year-old or the unhealthy 60-year-old? What do you think? Both could die from dengue. But who's more likely to die from dengue? Folks, it's obvious the person who doesn't take care of themselves is more likely to die. So, it's about lifestyle. It may not directly influence disease transmission or the spread of highly infectious diseases, but it will certainly affect what we call the prognosis of the disease, which is the chance of a good or bad outcome. So, if you want to learn how to have the world's best lifestyle based on scientifically proven information, I recommend you read my book, The Longevity with 100 Habits to Live Past 100, because the habits in the book will help protect you from cloth cancer. Why? It has chapters on exercise, diet, stress management, sleep, alcohol control, and smoking cessation. So, folks, click now on the first link in the description if you want to protect yourself not just from cloth cancer, but all other cancers, heart attacks, strokes, anxiety, and depression. Click now on the first link in the description or the pinned comment to get your longevity code today.